And today we are going to talk about a situation where you are supporting a family member, a friend, maybe who's had a very difficult diagnosis. The diagnosis could be a cancer diagnosis, or it could be another chronic condition which is basically life-changing. So that's a very difficult pill to swallow, and it's very important that as friends and family we are very aware of what we should do to support someone in that situation. So the reason why I am talking about this is in the last few weeks, months, there has been news that Princess Catherine has a form of cancer. So that was the trigger for me to actually think about how we can support a relative, a friend, a family, whatever, who has had a very difficult diagnosis like hers. I hope this is something that you will find useful, so stay with me. So, first and foremost, this individual needs emotional support. So how do you provide that emotional support? The thing is, people think if someone is going through a hardship, i.e. a diagnosis, a chronic condition or something like cancer, that they need you to tell them that it's going to be okay. Trust me, they don't need you to tell them that it's going to be okay. Instead, they need your emotional support. And how do you show emotional support? It might be just listening. So it's not about you providing a solution. I know it's very tempting to think that you can always provide a solution, but there are situations that you are only needed there to just listen. And you can do that, and also don't be awkward with it. Sometimes if you are not sure what to say to them, tell them that, I'm here for you, although I don't know what to say to you, but know that I am here for you. Because this is probably something new for you as much as it is new for them as well. The other thing is giving them a hug, giving them a squeeze on the hand. That conveys a message that you are there without you saying it. So those little gestures make a difference as to how someone feels supported when they're going through such a difficult time. Call them as well. So don't avoid them. It might be awkward. It might be you are also trying to process the news yourself. So it might be tempting to stay away. But instead, call them, text them, just make contact to make sure it tells them that although you are not there physically, you are thinking of them, which is very important to know that someone is thinking of you in a difficult time. And the other thing is, listen to them. So instead of trying to provide solutions and telling them, have you, looked for a second opinion, have you done this, have you done that, just listen to them. And they would appreciate that. Sometimes they can vent. Listen. And the other thing, because it's such a difficult diagnosis, other people might maybe want to be alone at times. That's also fine. Respect their privacy. But that doesn't stop you from sending a text. That doesn't stop you from sending them a voice note, encouraging them, or just telling them that you're thinking of them. Yeah, so you can do those things without being in their face every day if that's not what they want at that point in time. And try to still keep your relationship as close to normal as possible. So if it's a situation where maybe you always used to go out for dinner every month, or you used to do something together, try and keep to that usual routine, usual pattern in your relationship, as much as they will allow you to do that, of course. That helps to not show that things have changed so much, because at the end of the day, you are both the same people. It might be that there is this chronic condition, which might mean you need to adjust things a little bit depending on the diagnosis, but it doesn't mean that you can't do the things with them that you were doing before. Have conversations with that individual who has had a cancer diagnosis or another diagnosis which is life-changing. Have a conversation with them, listen to them, and give them the time to express themselves, express how they're feeling in that moment. We all know they are going through some form of grief at this point. So, and with grief, you go through all the different stages at different times, and you go back to the other stage, and then you come back to another one. So just stand with them in that moment, irregardless of whatever part of that, I call it, I guess, a grieving process, or a process of trying to rationalize everything and trying to deal with everything. Just the most important thing is to just be there for them. And it's very key that you are there not to change anything or try to suggest that they do this, do that, do this. No, just be there. That's it. And you can use humor in conversations with someone who has had a diagnosis only if that was the dynamic of your relationship. So if your relationship was very much a jovial, funny, whatever, then carry on doing that. But don't try and use humor to buffer awkward situations, because that just becomes even more awkward. And one other thing, it's okay to just stay in silence. What I mean by that is, instead of trying to fill in the gaps because you're anxious, you're nervous, you're trying to provide a solution to this situation, which frankly you can't provide a solution to, it's okay to just stay in silence together and just be. Now, let's talk about practical support. Right? For example, I'll use cancer as an example, but this would apply to any situation where someone has had an unexpected diagnosis, which is possibly chronic, which they possibly have to take some medications forever or for a very extended period of time. Make sure that you provide practical support. So you have provided emotional support and you've listened. Now get to work. Provide practical support in the form of, for example, they need to go for chemo. If you can make yourself available so that you can take them to their appointment, that would be most appreciated. The other thing you can do is prepare meals for them, because they might not be in a position to actually do that themselves, especially with chemo, radiotherapy and stuff like that. Someone might not be able to physically do some of the things themselves. So you can do those things for them. So that's practical. You can run errands for them, So if maybe there's someone who has a pet, a dog, if you can, walk their dog for them. If there's someone with children, offer to help them with childcare, for example, when they go for their appointments. So that is practical help that at least takes the burden of worrying about what's going to happen when I go for my appointment. And the other thing is, I did touch on this before, if you're going to take them for their appointment, you can go in with them, assuming they consent to that, and just provide that emotional support while they are seeing their specialist or whoever is seeing them. Offer to do some shopping for them. I know nowadays there's online shopping, but not everyone does online shopping, and some people are not doing that at this point. So you can offer to do their shopping for them, and also at that point in time when you actually bring the shopping to them, you can get a chance to see them as well and see how they're actually getting on with whatever is happening. So So that is on practical. I'm very big on practical stuff. I'm not someone who appreciates someone who will just talk. I need you to do the practical. Show me. Yeah. So people who had a chronic diagnosis would likely appreciate some practical help as well. Okay, let's talk about what not to say, what not to do when it comes to supporting someone who has had a difficult diagnosis. First things first, do not tell them that you know what they're going through, that you understand what they're going through, because frankly, you don't. They are the one who is going through that situation at that time. So don't tell them that you know. Just tell them that you're there instead. The other thing is, don't minimize what they are going through. Don't minimize their pain. Don't minimize their anxiety, because there would be anxiety with this situation. So don't minimize that, and don't personalize things. For example, if you want to see them and they say they can't see you, or they make some excuse why they can't see you, and don't be upset with that and take it personally, because it could be that on that particular day they are just going through a very, one of those days where they just don't want to interact, and that's allowed. In that moment, that's allowed. Allow them that. Yeah? So don't take everything or anything that they do in that moment personally, because people deal with grief and difficult diagnosis like cancer very differently. I know that from, my work situation, that you tell patients about a possible chronic condition, a possible cancer diagnosis, and people take things differently. Others are very much like pleading, I don't want to die. Others are very much like, okay, what's next? Very different responses to the same thing. So people are different. Just allow them to walk that path the way they feel best. Yeah? And please do not offer advice that they have not asked for. So don't come in there and say, oh no, I think you should do this, I think you should. No, don't offer advice if they have not asked for it. So wait for their cues. It's a very sensitive time, so deal with this time as sensitively as you possibly can. And another thing, do not compare their situation with someone else that you know who has gone through that situation. For example, someone has had a breast cancer diagnosis, for example. Don't start telling them about someone else that you know who's had it and all of that. Don't go there with them, because most people would likely not appreciate that. Instead, just be present with them in that moment, and I think just walk that road with them and give them that confidence that you are there for them in that time. Yeah, I hope this has been helpful. I do hope that you have learned something from this, and I hope that if ever you are in this situation where you are supporting someone who's had a chronic condition, a diagnosis of a chronic condition, or someone who is having who has had a cancer diagnosis or something similar, that you will know how to navigate that situation. Because one key thing, it's a very difficult time. It's a time where you need to allow yourself to be led by that person in terms of how you support them. So thanks for joining me, and I will be talking to you next time. And do let me know what your experiences have been. I know we have all at some point had difficult news, for example, about a chronic condition, whether it's ourselves or someone we know. So it will be interesting to see if you have anything to add to what I have just said. Otherwise, I will see you on my next video, and do take care. Bye bye.